Guys, my name is Bhuvnesh Daima and I am a student of class 11P. Today I am going to talk about my biology project and the topic for my biology project is typhoid. This is the index. This is the introduction. Typhoid fever is a bacterial infection that can spread throughout the body affecting many organs. So it's a type of a bacterial infection that can spread all over the body and affect many organs. Without prompt treatment, it can cause serious complications and can be fatal. If it is not treated, it can be dangerous. It's caused by a bacterium called Salmonella typhi, which is related to the bacteria that cause salmonella food poisoning. Typhoid fever is highly contagious. An infected person can pass the bacteria out of their body in their body poo or less commonly in their pee. If someone else eats food or drinks water that's been contaminated with a small amount of infected poo or pee, they can become infected with the bacteria and develop typhoid fever. Now we are going to talk about who's affected. Typhoid fever is most common in parts of world that have poor sanitation and limited access to clean water. Worldwide, children are thought to be most at risk of developing typhoid fever. This may be because their immune system is still developing. But children with typhoid fever tend to have milder symptoms than adults. Typhoid fever is uncommon in UK with around 300 infections confirmed each year. Most of these people became infected while visiting relative in Bangladesh, India or Pakistan, but you are also at risk if you visit Asia, Africa or South Africa. Now we are going to talk about the transmission. Typhoid fever and paratyphoid fever are transmitted commonly through the consumption of drinking water or food contaminated with the feces of people who have typhoid fever or paratyphoid fever or of people who are chronic carriers of the responsible bacteria. Now let's talk about the symptoms of typhoid. The main symptoms of typhoid fever are a persistent high temperature that gradually increases each day, headache, general aches and pain, extreme tiredness, cough, constipation. As the infection progresses, you may lose your appetite, feel sick, and have a tummy ache and diarrhea. Some people may develop rash and rose colored spots on the skin. If typhoid fever isn't treated, the symptoms will continue to get worse over the following weeks, and the risk of developing potential fatal complications will increase. Now we are going to talk about the preventions for typhoid. Wash your hands frequently in hot soapy water is the best way to control infection. Avoid using untreated water. Contaminated drinking water is a problem in areas where typhoid fever is common. Avoid raw fruits and vegetables. Choose hot foods. Boil and cook food thoroughly. Avoid preparing food for others until your healthcare says you're no longer contagious. Follow your healthcare provider's instructions for taking your antibiotics and be sure to finish the entire prescription. Now let's see what causes typhoid. People who drink contaminated water or eat food washed in contaminated water can develop typhoid fever. Using a toilet contaminated with bacteria and touching your mouth before washing your hands. Eating seafood from a water source contaminated by infected poo or pee. Contaminated milk products. Eating raw vegetables that have been fertilized with human waste. Let's talk about the treatment for typhoid. Typhoid fever requires prompt treatment with antibiotics. If typhoid fever is diagnosed early, the infection is likely to be mild and can usually be treated at home with a 7 to 14 day course of antibiotics tablet. More severe typhoid usually requires admission to hospital so antibiotic injections can be given. With prompt antibiotic treatment, most people will start to feel better within a few days and serious complications are very rare. Now let's talk about the conclusion. Typhoid fever is common in places with poor sanitation and a lack of safe drinking water. Access to safe water and adequate sanitation hygiene among food handlers and typhoid vaccination are all over effective in preventing typhoid fever. Now I would like to express my special thanks of gratitude to my biology teacher, Mrs. Amrita ma'am, as well as our principal, Mr. Sudhakar sir, who gave me the golden opportunity to do this wonderful project on the topic typhoid. Secondly, I would like to thank my parents and friends who helped me a lot in finalizing this project within the limited time frame. Lastly, I like to thank all of my supporters who have motivated me to fulfill their project before the timeline. Thank you.